Genital warts are small, fleshy growths that can appear on various parts of the genital area. These growths can vary in size and shape, sometimes appearing as small bumps or clusters that resemble cauliflower. They are often skin-colored or slightly darker, and can be raised or flat. They appear on the genitals, including the vulva, vagina, cervix, penis, scrotum, or anus. In some cases, they can also develop in the mouth or throat of a person who has had oral sexual contact with an infected partner. Genital warts are a common sexually transmitted infection, or STI. They are one of the most frequently occurring STIs worldwide, affecting millions of people each year. Awareness and education about STIs are crucial in managing and preventing their spread. Genital warts are caused by certain strains of the human papillomavirus, or HPV. HPV is very common with many different types, some of which can lead to genital warts. It's important to note that not all HPV infections result in visible warts, and some strains are more likely to cause warts than others. Many people with HPV don't have symptoms, and may not even know they are infected. This asymptomatic nature of the virus means it can be unknowingly passed on to sexual partners, contributing to its widespread prevalence. They can still pass the virus to others through skin-to-skin contact during sexual activity. This includes vaginal, anal, and oral sex. Even if warts are not visible, the virus can still be transmitted. Genital warts can cause discomfort, including itching, burning, and pain. In some cases, they can become irritated or bleed, especially if they are in an area that experiences friction during sexual activity or other movements. They can also be emotionally distressing. The presence of genital warts can lead to feelings of embarrassment, shame, and anxiety, impacting a person's self-esteem and sexual relationships. It's important to seek support and medical advice if you are affected. Knowing how to prevent genital warts is crucial. Using condoms and dental dams during sexual activity can reduce the risk of transmission, although they do not provide complete protection, as HPV can infect areas not covered by these barriers. Protecting yourself and your partners is important. Open communication with sexual partners about STI status and sexual health can help in making informed decisions and taking preventive measures. This essay will discuss various methods of prevention, including vaccination, safe sex practices, and regular medical checkups. Vaccines like Gardasil can protect against the most common strains of HPV that cause genital warts and certain cancers. Regular screenings and early treatment can also help manage and reduce the spread of HPV. HPV is a group of viruses. There are many different types of HPV. Some types cause genital warts, other types can cause cancer. HPV is spread through skin-to-skin contact. This usually happens during sexual activity. Not all HPV infections lead to genital warts. Most HPV infections clear up on their own. The body's immune system fights off the virus. However, if the infection persists, it can lead to genital warts. The HPV vaccine is a safe and effective way to prevent HPV infection. Human papillomavirus, or HPV, is a common virus that can lead to various health problems, including genital warts and certain types of cancer. The vaccine works by stimulating the body's immune system to fight the virus, providing long-lasting protection. It protects against the types of HPV that cause most genital warts. In addition to preventing genital warts, the vaccine also protects against the strains of HPV that are most commonly associated with cervical, anal, and other types of cancers. This makes the HPV vaccine a crucial tool in cancer prevention. The vaccine is recommended for adolescents. Ideally, it should be administered to boys and girls at the age of 11 or 12, but it can be given as early as age 9. This early vaccination ensures that they are protected before they are ever exposed to the virus. Adults up to age 45 can also get vaccinated. Even if you miss the vaccine as a child, it's not too late. Adults who are at risk of new HPV infections can still benefit from the vaccine. This includes those who may have new sexual partners or other risk factors. The HPV vaccine is most effective when given before exposure to the virus. However, even if you have already been exposed to one type of HPV, the vaccine can still protect you from other types. This is why it is important to get vaccinated regardless of your sexual history. It is important to get vaccinated even if you have already been sexually active. The vaccine can still offer significant protection and reduce the risk of developing HPV-related health issues. Consulting with a healthcare provider can help determine the best vaccination schedule for you. The vaccine can still protect against HPV types you haven't been exposed to. Regular checkups and discussions with your healthcare provider can ensure that you are up to date with your vaccinations and protected against HPV. Remember, vaccination is a key step in maintaining your overall health and preventing serious diseases. Condoms are a barrier method of contraception. They also provide protection against STIs, including HPV. When used correctly and consistently, condoms can significantly reduce the risk of HPV transmission. It's important to use condoms during all types of sexual activity. This includes vaginal, anal, and oral sex. Condoms should be used even if you are in a monogamous relationship. This is because you or your partner may have been exposed to HPV in the past. Section 5. Safe sex practices. Navigating intimacy responsibly. In addition to vaccination and condom use, other safe sex practices can help prevent HPV. Limiting your number of sexual partners can reduce your risk of exposure. Open and honest communication with your partner about sexual history and STI status is crucial. Regular STI testing is essential for maintaining sexual health. This allows for early detection and treatment of infections. Remember, early detection and treatment can prevent long-term complications. Section 6. Regular testing, a cornerstone of sexual health. Regular testing for sexually transmitted infections, or STIs, is a fundamental aspect of maintaining sexual health. It's not just about protecting yourself, but also about safeguarding the health of your partners and the community at large. Regular STI testing is crucial. It serves as a proactive measure to ensure that any potential infections are caught early. Early detection can make a significant difference in treatment outcomes and can prevent the spread of infections to others. This is true even if you don't have any symptoms. Many people believe that if they feel fine, they must be healthy. However, this is a dangerous misconception when it comes to STIs. Many STIs, including HPV, can be asymptomatic. This means that the infection can be present in your body without showing any signs or symptoms. HPV, for instance, is one of the most common STIs and often goes unnoticed because it doesn't always cause immediate health issues. This means you can have an infection without knowing it. Asymptomatic infections can still cause long-term health problems if left untreated. For example, untreated HPV can lead to serious conditions like cervical cancer in women and other types of cancer in both men and women. Regular testing helps detect infections early. Early detection is key to managing and treating STIs effectively. When infections are caught early, they can often be treated more easily and with fewer complications. This allows for timely treatment. Timely treatment not only helps in curing the infection, but also in preventing its spread to others. It can also reduce the risk of long-term health issues that can arise from untreated infections. Talk to your healthcare provider about STI testing. Open communication with your healthcare provider is essential. They can provide you with the necessary information and support to make informed decisions about your sexual health. They can recommend the appropriate tests based on your sexual history and risk factors. Your healthcare provider will consider various factors such as your age, sexual activity, and any symptoms you may have to determine which tests are most appropriate for you. Don't be afraid to ask questions. Your health is important. It's crucial to feel comfortable discussing your concerns and asking questions. Remember, your healthcare provider is there to help you, and no question is too small or insignificant when it comes to your health. Section 7. Open communication, building trust and safety. Open communication with your sexual partner or partners is vital. Discuss your sexual history. Talk about any past STIs. This builds trust and allows both partners to make informed decisions about their sexual health. Don't be afraid to ask your partner about their STI status. If you or your partner has an STI, it's important to discuss treatment options. Support each other in seeking medical advice. Section 8. Visible warts, understanding the risks. If you or your partner has visible genital warts, it's important to avoid sexual contact. This helps prevent spreading the virus. Treatment for genital warts is available. Treatment options vary. They include topical medications, cryotherapy, which is freezing, and surgical removal. It's important to consult with a healthcare professional. They can determine the best treatment option for you. Section 9. Prioritizing your sexual health, a lifelong commitment. Preventing genital warts is a lifelong commitment. It involves making responsible choices. Get vaccinated. Practice safe sex. Communicate openly with your partner or partners. Remember, your sexual health is important. By taking proactive steps, you can protect yourself and your partners from HPV and genital warts.